All right, everyone. Thank you so much for your patience with those technical difficulties. You would think, I have got it down. We've all gotten used to the virtual settings, but technology keeps me humble. So thank you so much. I hope that we haven't taken too much of your time. We'll get started very shortly. If you know anyone else that is also having trouble, I know some folks have coworkers who are joining. Please share the link with them so that we can get that out to as many as who registered as possible. So again, I want to thank you for joining us today. I also wanted to share that closed captioning is available at the bottom of the screen by clicking or tapping on where it says CC Live Transcript and then show subtitle. You can also adjust the subtitle settings to your preferences. So to make up for a little bit of time, we'll go ahead and get started. I want to start this event with a tribal land acknowledgement. Though we're not in person, it is still important that we acknowledge that YWCA resides on the traditional homelands of the Spokane people and Indigenous peoples connected to this region. We wish to recognize the Indigenous peoples who have been dispossessed and displaced from their ancestral spiritual homes and the taking of their land through colonization. A land acknowledgement is just the first step in honoring contributions of Native Americans and Indigenous peoples today, and we continue to work on policies and practices that bring about justice and reconciliation. We respect and honor the first people of this land, past and present, on which we advocate, work, and live. And I also want to take this time to not only, thank the panelists, but all of you who are spending your lunch hour with us this Wednesday afternoon. Thanks for being a part of this important conversation. Now I will turn it over to Misha and Erin to introduce themselves to you all. And you can turn your cameras on now. Erin, let's go ahead. Oh, Misha, go ahead.
Hi, everybody. I'm Misha Lehman. I do outreach at Index, which is Inland Northwest Disability Experience. I use they, them pronouns, and I am multiply disabled. Some of my disabilities I've had all my life, some are newer, and I'm also queer and trans, so happy to be here.
Hi, I'm Erin Ferrier. I'm the program manager at Index. As Misha said, it's Inland Northwest Disability Experience. I'm also disabled. I'm autistic. And I'm really excited to be here today to talk about disability pride and intersectionality and all that.
I'm excited too. And I guess I should also introduce myself. I'm Lara. I am the equity coordinator at YWCA Spokane. My pronouns are she, they. I am a brown Filipino woman with brown hair, brown eyes, and a nose piercing in one nostril. So I want to just quickly give an outline of our time together. Like other Pathways Forward events, this discussion has three parts. We'll define the problem or problems and issues. We will outline some solutions, and then we will then shift to the Q&A portion to have Misha and Erin answer some questions that have been submitted by the registrants beforehand. Over the course of this conversation, questions might arise for you. Please feel free to enter them into the Q&A box that is at the bottom of your screen so that we can make sure we're catching all of the answers that you might have. Also, please feel free to utilize the chat feature to share any thoughts, observations you might have, anything that's resonating with you to connect not only with us, but to the other folks that have joined us in the audience today. Zoom has recently changed some of the settings. So if you are sending a message, make sure that the option is set to everyone. I think before it used to be like participants and panelists, or something like that. So the wording has changed a little bit. So in this first section, when we define the problem, we will also kind of define what is a disability. And Misha will talk more about that. But, when me, Erin, and Misha met to kind of maybe highlight some points that we wanted to make sure that we were able to talk about, Pride came up for us, and the Pride Festival and Parade that happens in downtown Spokane every June. It was a really great celebration of our queer communities, and it's really great to continue this celebration and the conversation into July, with it being Disability Pride Month. I was able to actually see Misha in person at this year's parade, and it was really great to meet them in person. And we in our like preliminary conversation, we had some observations about how things were laid out, how things went, what the festival looked like. So Misha, I would love for you to, share some thoughts and what kind of you saw during that day.
Yeah, accessibility at Pride is something that's always been really important to me. And like, I went to Pride a few years back, and then that was the last Pride I attended before this year's Pride. And I knew that they'd made a concerted effort to improve accessibility, but there were still problems. And I mean, like, that's what happens, right? When we work to do things better, there's always going to be things that we have to continue adjusting to make them accessible or just. And what I found was they moved a lot of things off of the hill and onto solid ground, which was really helpful for me. But a lot of the nonprofits especially were still like moved onto the grass and onto hilly grass. And I use a walker to get around. So I was exhausted trying to roll over that grass and up the hill. And like, it would mean so much to me if they could get everything actually onto paved portions of that area for walker users like me, wheelchair users. Even when I'm with a cane, like unsteady ground is not gonna be the best, but I was really excited to see the effort that they put in and that they continue like moving off of the grassy hill and onto that sidewalk area, especially so that stuff's not crowded in, because when you're crowded, if you're like a mobility aid user, it's like you end up in gridlock. It's not easy, but I'm excited about the work they're doing.
Yeah, as someone that doesn't, have to use any kind of wheels, uneven ground, whether it's pavement or, grass, can still be kind of like a very like cautionary, like you have to be very careful where you're walking, grass isn't, or dirt's not smooth, like that kind of thing. There's holes, even though we don't put anything in, we don't stake anything into the ground when we're tabling downtown in that area. So yeah, there's just a lot of, those small things that maybe are overlooked sometimes. I wanted to share a statistic in doing a little bit of research to prepare for our discussion. I found some pretty interesting facts just to kind of give me a sense of the disability communities in the United States. 1 in 4 adults in the United States has a disability, and that equates to an estimated 61.4 million people. So like, when you say 1 in 4, those numbers might sound small, but when you include the entire population of this country, that's a really significant amount. Misha, I would also love for you to define for our audience, what disability is and how it can look, the difference between, visible disabilities or, less visible disabilities.
Yeah, I'd love to take on disability. Disability has a lot of definitions according to various people. Like the CDC talks about a condition of the body and the mind, impairment that makes it more difficult to do some activities or to interact with the world around them. And that reflects what we kind of consider the medical model of disability, which is that there's something different about your body or your health that impacts your life. And the other model of disability, the social model, considers how the world affects a disabled person's life. For example, if you have a world without stairs versus a world with stairs, those are going to be very different for wheelchair users and walker users. If you have a world that has universal design for sensory needs, somebody's going to be impacted differently by those. So the social model considers the ways that the world is not designed for a person with a disability and considers those outside factors or social factors versus something inherent that's an impairment. So that's just a little bit. Erin, do you want to talk about visible and invisible disabilities? I feel like you do a great job of that.
Sure. Because there is confusion between the two, because the visible ones people tend to be willing to provide accommodations for. They're a little more understanding. But when you have something like autism, which I have an invisible disability, you kind of get ignored because it's not something that can outwardly see it unless because I do a lot of masking. So you're not going to see me do what I usually do in private, which is my stimming, and I do flap and I do other things that it's a little more.
Yeah, can you share just a little bit more about masking, stimming, all those different definitions?
So I can define it as I do it because everyone has their own way of masking. I learned how to mask at a very young age. And that was long before I knew that I was autistic, because I was diagnosed in my 30s. And so it was more of a survival mechanism that I developed to try to hide who I was, not knowing why I was the way I was. And it just continued along as I grew up, and I had to more and more layers of trying to pass in this world that doesn't really it's not exactly understanding to people with disabilities, particularly invisible disabilities. And then I move on and older and get trained in the professional world, and the professional mask goes on. And so it can be really exhausting having to maintain these masks. And so right now you're seeing my professional mask of 25 years of being a teacher. So when I leave this platform, I'm going to be doing whatever I need to get myself to regulate again. And that's where the stims come from. And everybody's stims, some are more noticeable because sometimes people bounce their legs, sometimes they click their pens, sometimes they twirl their hair, but other times people do a little more, a little more obvious ways of stimming to help with self-regulation. And there's nothing wrong with stimming. When it becomes an issue is if you're hurting yourself or somebody else. So if somebody is worried about somebody else stimming, think about, is it really hurting you or anyone else? And if it is, what can you replace it? Don't take it away, but replace it with something that the person can utilize to help with self-regulation. So I hope that answers that question.
Yeah,
I
is
think
that
that
come from stimulation, that's what I'm thinking of. It's is it short for a word or just a kind of slang?
Yeah, it's ways of helping a person regulate themselves.
Okay.
To keep them, because if I was standing right now and I was in front of a class or a group of people, I would be rocking back and forth. I might be slinging my fingers, and these are just ways that I can keep myself calm while I can present my professional mask. So it's just movement, sounds, ways of kind of using, like, I don't know, the clicking too. It's just ways to help with keeping your body calmer and focused.
And it's a response to like often being understimulated or overstimulated by our environment. And I feel like that also comes down to the idea that somebody's disability can be visible sometimes and invisible at other times. Like, Erin, if you're like in a classroom or a group of people and you're rocking back and forth, like they might notice that you're disabled. And so like that's when like that disability becomes visible. And like, for example, with me like sitting right here, like you don't see my walker, you don't see like my cane or any like other of the indications of my mobility disability. But if I was out and about in public, like it is a rare event when I can like get more than like 5 feet from like my front door without a mobility aid. So if I'm in public, I'm visibly disabled, even if like it's not from a difference in my body that you can see. Like my mobility issue doesn't come from a limb difference or something like that, but you'll see like evidence of a disability. So I think almost all of us are visibly disabled sometimes and invisibly disabled other times.
Agreed.
Yeah, that makes total sense. I don't want to go too much into the history of the independent living movement, as you know, we were going to originally. I will say that, or I would like to share that, you know, that movement came right up against the civil rights movement. So, you know, while all of that was going on, accessibility also was included kind of at the tail end in the 60s and 70s. And one recommendation that I really resonated with is the documentary Crip Camp. It's a very lovely documentary about these teens and youths that go to summer camp for disabled folks. And, you know, it also shows like when their advocacy and activism starts to form. And a lot of those folks that were in the documentary actually go on to become part of the independent living movement. And we can share more information afterwards when we send out the recording and the recap. But Erin, I would love for you to talk more about independent living as it is, you know, today and what that is.
Sure. And it has been a very long, hard fought movement, and we're still fighting. So when we think about the independent living movement now, after we've had these monumental disability right laws passed, and that includes Section 504 in the Americans with Disabilities Act, we still are running into barriers. People are still struggling to live where they want to live, how they want to live, making decisions for their own person. Too often the presuming competence is not happening. And so people looking at them treating them like children when they're perfectly competent adults. They just might move differently, or maybe they just think a little differently. They need some accommodations to be able to access what everybody else accesses. So when we think about independent living, it's huge. It encompasses a huge amount of aspects of our life. And it's tailored to each person, because we each have our own needs and our own wants. We each have our own, you know, we need to have certain accommodations in place so we can access various levels within the world that we live in. So it's the independent living movement and the independent living centers. We tailor fit everything to the individual to help them be able to access. So it's all about access, equity, equality, that sort of thing. And so when we think about it, it's not a place. We're not thinking about a place when we're thinking about independent living. It's a movement. And it's big, but people don't really know how big it really is, or even know what it is, because it is pretty much centered on those with disabilities, both invisible and visible. And so we tend to get shoved off to the side And it is challenging to break down those barriers, and it is built into the system, which we'll get into, and the different layers that are built into that, like why intersectionality is so important and when we're looking at the independent living movement. But that's what Index comes in. We kind of help with that. A little plug in what we do. But we do cover 5 different counties, Spokane, Stevens, Ferry, Pend Oreille, and Lincoln. And we cover, everything, all ages, all disabilities, and we help where we are needed, pretty much.
Erin, you mentioned it, you just briefly kind of touched upon it, but I really want to focus in on intersectionality, what that means for people, what that means for, queer communities, and, what that is. Misha, I don't know if you would like to just maybe kind of elaborate a little bit
Sure.
more, like really lay it out how that all
Yeah.
impacts the queer communities.
Yeah, intersectionality looks at the whole person, and it's a term that was coined by Professor Kimberly Crenshaw in 1989, and it talked a lot about race, class, gender, disability, and such initially. And in this case, we're looking at how different kinds of discrimination and privilege will intersect within like a single person, because it's not like a zero-sum game where you can, add up somebody's privileges and disprivileges to find out exactly what they're going to experience. It's something that looks at the whole person, and LGBTQ plus people with disabilities face really complex systemic oppression tied to each of their identities in the whole. So like picture a woman of color who is also a lesbian and who's disabled. What do you think like her barriers would be interacting with the world? How many layers of discrimination would she face? Consider like a trans man who's autistic and trying to get healthcare. And, in several states, there's legislation that specifically bars autistic people from gender affirming healthcare. So when you think about like all of these layers of a person, you're going to find that they're going to have different experiences that affect their lives.
Yeah, and just to add a little bit more context, there are studies, reports, and so well, I would say some are. There's still a lack of kind of reporting when it does come to different layers of identity and people with disabilities. But more than a third of cisgender queer adults and more than half of transgender adults, that includes both LGBTQ plus and straight transgender adults, reported a disability. And 1 in 3 adults self-reported, compared to 1 in 4 non-LGBTQ adults as having a disability. So now that we've kind of talked about some of the issues that people with disabilities face, some of the problems, I do want to shift a little bit to thinking about how can we cause less harm going forward? How can we care for our disabled communities better? If you have some questions, I encourage you to share them. I'm sure you're not the only one that has that question. We are looking forward to the Q&A portion because a lot of great questions have been submitted, and we'll also speak more about how to care for disabled communities. But I know Erin has a story, actually that is her daughter's, who she's allowed to share and just kind of talk about her experience.
Okay, yeah. And thank you for giving me an opportunity to share this. And I'm not being paid to talk about this organization. I'm just so grateful as a parent that they exist. I live in Stevens County, which is a rural county north of Spokane County. We don't have supports for LGBTQ folk. And again, I'm going to be speaking as a parent. And so this community resource is something I knew about already. I worked with them as a professional. I was really impressed with what they were doing. But then we had a crisis in my family this winter. And so this is why my daughter will let me share a little bit about that. She's been attending college over on the west side. She's just finished up her 3rd year there. And my daughter was diagnosed with bipolar when she was 8 and then autism when she was 10. So we've been dealing with services for 14 years. And this isn't the first mental health crisis she's been in. It was just one of the worst ones. And so it was really significant, and she had already been using the 998 crisis line. Twice. She's been working with her med manager and a counselor, trying to figure out, can we, helping her come through, get through this crisis. It got so bad that her doctor told her that she either had to call an ambulance to get her to the hospital, or she had to come home immediately. Well, this is across the state where she's at, and I couldn't get to her. And so it's really, really scary as a parent when your daughter is suicidal and we can't reach her. But she was able to get an Uber, to get on a bus, to get her across the state to Spokane, where I picked her up. And then we immediately got her into triage at home. And one of that is getting her into social groups. Well, since we live where we do, we don't have these safe places to go. But Odyssey Youth Movement in Spokane does exist. And they welcomed my daughter in during their adult drop-in times, and it has meant the world to her. It has basically saved her life because she was found a place where she was welcomed. They didn't care that she was disabled, didn't care that she was part of the LGBTQ spectrum. They were just like, come on in, let's make you feel safe. Here's an art room, have fun. And so that's usually what she does. She doesn't say much when she goes, but she says she feels safe and everyone is friendly there. I'm just so thankful that they exist. And it's a 3-hour round trip for us to go every week to go to this peer group for my daughter. And I do recommend them to help just have this safe place. And that's part of the resources that will be shared today, but they are located on South Perry Street in Spokane, and they do both youth and young adult drop-in times. And you can find more information on their website, but they help people feel that they can be authentic in their bodies in a safe place. So it is just incredibly wonderful that they exist.
Yeah, please tell your daughter, thank you for allowing us to learn more about her and for her to tell her story through you. Odyssey Youth Movement is always at the Pride Festival, and they also host their own Pride event in the Perry District every June as well. Yeah, they're pretty great. I'm glad that your daughter has that resource, even though that 3-hour drive does sound pretty rough.
It sounds like a lot. I want to talk about other ways of bringing together resources and some of the things that I've encountered, like being a person with multiple disabilities. I've found that in the last 3 years, especially, I've been hearing people say COVID is over pretty much since the beginning of it, and it's still not over now. I'm really vulnerable to COVID, so I've essentially been isolated in my home and in empty outdoor spaces pretty much for the last 3 years of my life. And I've really lucked out in terms of some of the friends I have that they've been willing to do things like go foraging with me or call me on Zoom, things that a lot of us were doing back in 2020, but that have dwindled a lot now. And I wanted to give kudos to the Trans Day of Resistance, which is an event that I wasn't able to attend very much. I made it to the parking lot, but due to my disabilities, I basically waited at the car and was able to also see some people outdoors, but not go in. But my partner went in and said that most folks were wearing masks, and that's something that's really important for keeping events safe for people with disabilities. A lot of us also have compromised immune systems, and we can't really be somewhere unless folks are taking measures to keep us safe. And this also goes back to LGBTQ history, because a lot of the same messages that I was hearing about COVID for the last 2 years are the same things that people said about AIDS and HIV in the 80s and 90s. And we're not disposable. And whenever people view these illnesses as something that like only affect a marginalized person who's not like them, they often dismiss it as unnecessary to worry about. And we're here in communities, and you should care about us and our lives.
Absolutely. And that is, I think, a great segue into, other things that you wish people knew about other queer people with disabilities, like what are some other maybe myths or misconceptions that you've heard over and over again that you've had to repeat yourself about, that you just wish people would kind of grasp?
Yeah, I'll take a bit of the first, but like I feel like often we're kind of treated as a zoo exhibit. Like people will stare or think that like we're just trying to get attention. Like if you're literally walking around with a mobility aid, like I've seen that. I've had that happen to me. And I mean, the younger generation is the queerest generation yet, but like a lot of people feel that like even as an almost 30-year-old, I'm too young to know who I am as a disabled and a queer person. And it's so weird. So I wish people like didn't think of us as an oddity in that way.
And, and of course, there's that higher percentage of transgender people in the autistic community. Just overall queer, there's a higher number within the disability, as we've talked about. It's just, and people just don't want to think about that. They like, you're disabled, you can't be that way. You got to be this kind of childlike thing without having an identity.
And I agree. Like I've worked as a paraeducator before, and I've seen like behavior plans that have like gender conforming like written into what the child is supposed to do. And that's illegal, by the way, but it happens. And so there's like a belief that like to correct like an autistic child's behavior, you have to like make them gender conforming, which is like ableist and transphobic and homophobic all at the same time. So it's really gross.
Can you talk more about, it kind of sounds self-explanatory, but like the behavior plan, what that is?
Yeah, a behavior plan. In this case, I was seeing it written into students with an IEP. And so that's what they have to like have their teachers observe for them to be in their classroom. So it's a legally binding document that kind of directs what a teacher and or a paraeducator will do with this student. It's supposed to be for accommodations, but I really fail to see how child being gender conforming is any kind of accommodation. But you might see this if a child like needs a behavior support, like maybe they need to be able to access sensory supports. So their paraeducator has to be able to provide that to them. Like that would be an example of an actual accommodation that could be part of a behavior plan. Other things that, in my opinion, should not be in behavior plans are things like if the child wanders around the school, call the police, which I've also seen in a behavior plan and was horrified by. So there's definitely like, this gets kind of deep into like what educators have to do. And so like, it's not something that I feel like most people who don't have a disability or an education background would see.
Yeah, and I, as an educator myself, I always saw them as more of a behavior plan for the adults. to be consistent to overall throughout the day, so the child is supported in the way that they need. But it's been kind of shifted over, saying, no, this is something we have to make the child be or become. And so it has ended up hurting kids in various ways. And so it's just, the mindset is a little different than when it was when I was still actively in the classroom.
Still going along those lines of, how to support communities with disabilities, what are some action steps that a person can take to improve accessibility, especially in the LGBTQ community, and overall acceptance of queer disabled people?
Yeah, I'm going to take this kind of from the disability side of access for us in LGBTQ plus communities, and then let Erin take the reverse. I think the most important thing is to actually include us in the process and consider what our needs are, implement universal design, but also find out what the actual people in your communities need, just because conflicting access needs are a real thing, and you're not going to know what a disabled individual needs until you actually talk to them or talk to somebody who works with a community group and knows what the people here need. So make us part of it. Erin?
Yeah, and when I talk about LGBTQ plus issues, I always want to put that caveat out that I look like I can pass as, as a heterosexual. I am cisgender, but when it comes to being on the LGBTQ plus spectrum, I'm the A and they're the asexual. And so when I come into these spaces, I want to make sure people do understand I don't want to overstep the voices of those there, and I kind of keep myself off to the edges. So it does become a challenge to be finding acceptable places to go into when you are in that asexual spectrum, because that's a spectrum in itself. So when we're thinking about finding acceptance in disability spaces, we need to make sure and remember that we're all human and we're all going to be across the spectrum. Everything seems to be a spectrum when you look at it. And some of us are going to just present in ways that you might not think stereotypically that a certain label would present. As I said, I wear a mask when I go out into public. I present out as a certain way. And this is just having grown up as I did as a Gen Xer. This was for survival. We didn't talk about LGBTQ plus stuff when I was growing up. I still remember the pink triangle. That was just coming out when I was still in public school as a student. And so that was, if a teacher had that pink triangle, it meant safety, but it also put the teacher at risk of being fired. So that was a real issue. And so now things are opening up and there is more acceptance in spaces, that there's these generations of people coming in not knowing how to navigate in those, because we grew up not allowed to at all, not talk about it, not, it was just a big no. And so when we think about disability spaces, it's just like what I always bring up the Odyssey again, is they welcome everybody. Just think about it when everyone comes in, they're all going to be different. They're all going to have this background. They're all going to be carrying their own trauma from wherever they're coming from. And so the way that they interact in these spaces is not going to be the same across the board. So we just need to be mindful that people are going to be coming in maybe a little confused, maybe not knowing the language, because I am still learning it, even in my 40s. The language has changed quite a bit from when I was in my 20s. So it's a continual learning thing, and we just need to be open-minded and be willing to learn. I think that's what really is needed when we find that acceptance piece in disability spaces.
Absolutely. I fully agree, especially with the learning part, and admitting to yourself, that you're learning, you're going to continue to learn and hopefully grow from what you've learned. I also really I appreciate you pointing out, your different identities and talking about how you present. I know we had a similar conversation way back when, about that. And I really appreciated you, bringing that up, because that is it is a good point. And a lot of people would probably, assume like you're just a cisgender, like woman. And we are talking about asexuality and aromanticism. I think it will continue to be a topic of discussion. One thing that I saw new this year on the progressive pride flag was, I believe it's like the circle or the ring that's like inside the triangle portion of the flag. I don't know how else to describe it. But I just like seeing those identities coming to the forefront, because in a society where I think a lot of times we like to put things in very neat categories, or have everything be one way or another, it's very easy to assume that, everyone loves the same way. And like you said, it's mostly a spectrum. Everything is usually a spectrum. And I can't remember if it was you or I had read this somewhere, but like in the animal kingdom, like there isn't really that gender structure. Like it's also a spectrum, and it's actually like humans who have that very like binary thinking. So a lot of folks had, this similar question, what are some ways that people can work together to, advocate, continue this advocacy, that started within the civil rights movement. I think people are just looking for how to make things easier, what kind of systemic issues can be addressed, that kind of thing.
Yeah, I think a really important piece of this is solidarity. A question that I don't think we're going to get to talked about centering disabled, Black and Indigenous people of color in this movement. And I think that that's like really central to pushing these movements. Like, I think solidarity is the key to survival. And I actually got to talk to my coworker Arius about this, who's Black, and I went to a live stream hosted by Disability Pride the 19th something, and I learned from Raven Sutton there. And so like we have to work really hard to not center like fragility and anger, but to center like someone's experiences and actions you can take right now to be an accomplice. And so ask people what they need right now, not just what they need in general from the movement. Make sure to give BIPOC credit for ideas, and also to give like disabled folks credit for their ideas if you're non-disabled. And I think a lot of times we have a knee-jerk reaction in general to any kind of marginalized person to shut down an idea. And that's an implicit bias that often both happens to a person and that they also perpetuate against other marginalized people. So be really careful to combat that. That's something that is really harmful. And so for me, I interrogate that as like anti-Black racism, and that like definitely happens to me as a disabled person who's sometimes perceived as a woman and hit with misogyny. So like kind of see a lot of people are on both sides of privilege in some area. And so like working together is how we can fight that, I think. And Erin, I think you had some really cool resources, and I want to plug one of them, which is the Northeast Behavioral Health Forum. Spokane Behavioral Health Forum, which is meeting today and talking about BIPOC mental health. So, and then there's also the other one that I will let you say.
So the Spokane Behavioral Health Forum and the Northeast Family Youth System Partner Roundtable, or Northeast FISPERT for short, they both cover the same region. So which we all live in right now if you're in the Spokane area. So it's Ferry, Stevens, Ponderay, Spokane, Lincoln, and Adams. And so what the Northeast FISPERT does, that focuses on behavioral health, but it brings in everyone. So it's not just the system partners, it's not just parents, it's also the youth. The Northeast FISPERT needs 51% of family members attending, because this is a regional group that you can meet once a month and we discuss system problems. So it's not a counseling place. It comes in where you're with all the system partners, all the family members. We sit at a round table or through the virtual platform, and we discuss, hey, we're having issues. And it could be anywhere from special mobility services, which is coming up for very specific reasons. It could be anything from the kinship program, which actually got developed through Northeast FISPERT because grandparents didn't have the rights to take care of the grandchildren when they were the primary caregivers. So kinship program got developed through efforts of family and system partners at Northeast FISPERT. So everything that gets discussed both at the forum, the Spokane Behavioral Health Forum, and Northeast FISPERT gets reported to the state. So your concerns get recorded at the regional level and then gets presented at the state level in their various meetings that they have. So it's a really important place to come in and share issues that you're having at the system level. And this is how we get things changed. So it could be anywhere from dealing with racism to dealing with transportation issues to dealing with this medical care, and especially with the mental health area. And if you're experiencing racism and trying to get the medical care that you need, this is the place that you need to go to, both of these, and discuss those issues, because this is how we get the word out. And the more people we have involved in these organizations, the more change we can make and more improvements we can make. So I'm always just kind of putting in the Northeast FISPERT needs youth to attend. We need the youth voice. They haven't been able to keep many youth in there because for whatever reason, it's with COVID and everything, it's just youth don't really understand how important their voice is, and their voice really, really matters when it comes to their care. It's their life, and they need to have a say in what happens in their care. One thing as a parent, from my kids, as I said, they've been in, both of them are have multiple disabilities. And for 14 years, they have been a part of their own care. They get a say in what happens. And they, so that's that buy-in. Because if the kids don't understand what's happening, they don't have buy-in, they don't understand why they're doing what they're doing, improvement can't happen. And then we start hitting those behavior problems at school because they don't understand what is the point of all of this. So please, if you are a parent, I encourage you to have your children involved in especially the Northeast FISPERT, because their voice matters in all of it.
Thanks for sharing that. Before we start to wrap up, Erin, I would love for you to quickly share about what's happening in legislation, particularly with the SB 5599. We will share some additional information in the chat so that you can have a little bit more time to dig into it. And we will also share some bill trackers for bills that impact the queer communities. But yeah, just a minute or two about what happened in legislation this year.
Sure. So SB 5599, if you're all not aware with that one, it's supporting youth and young adults seeking protected healthcare services. So this went into effect, actually it is going to be in effect this month. And it did pass this year. And what it's about is mainly focusing on homeless youth and at-risk youth that are living in shelters or in foster care. And part of this bill includes gender-affirming care. And because of that, we're having a huge problem with various groups trying to get rid of the bill. And Referendum 101 is that bill trying to remove these protected healthcare services from this vulnerable population of youth. And research has shown that gender affirming care does save lives. And that was the whole point of 5599. It was to reduce the suicide rate among the particularly transgender youth. And it shows that applying this care, which could be anything from allowing them to get the haircut that they want, to using their pronouns that they want, to finding a counselor that is respectful of who they are and willing to meet them how they are as a person, finding stable housing that's safe. All of that is part of gender affirming care, and it does reduce the percentage of suicide rates that is occurring, and it's quite high. I think, it's around 50% at least attempting suicide. So it is quite a problem. And so that was the point of SB 5599. And I know I'm running out of time, but it's an important issue for me, and I can get on my soapbox and talk about this all day. But just understand that those that are pushing Referendum 101 are also using a lot of fear-mongering rhetoric, anti-LGBTQ rhetoric. They're claiming that the state now has the right to take the child away and force them into becoming transgender and giving them puberty blockers, and it goes on and on. So just know that it's not on the ballot yet, but if they get enough signatures, Referendum 101 will get on the ballot, the next ballot coming through. So just be aware, a lot of the fear mongering that's happening over SB 5599, it's not true. What they're saying. It's 5599 is about saving lives and finding stable housing for homeless youth. So, yeah.
Thank you. So yeah, as we start to wrap things up in the next few minutes, I would love for each of you to share a key takeaway from our time today. What, can we do to help us pave more pathways forward? What gives you hope?
What gives me hope is really solidarity. Like, I think about between different movements, like the disability movement is invested in the prison abolition movement because like prisons affect and institutions also affect people with disabilities like disproportionately. And when it comes to like gender affirming care, like Erin just gave a really great example about how like people who are LGBTQ, especially trans people and people with disabilities, we can work together to fight things that harm us all. So I think solidarity it's the word.
I echo Misha, yes. We need to work together. As a collective group, we can make change. We just have to come together and do that, which can be a challenge, I understand. But no, we can do this. I truly believe that we can make these significant changes to help people find that acceptance and get more access. We just got to keep going. We can't give up.
Absolutely. Erin and Misha, thank you again so much for not only taking time out of your day today, but for collaborating on this event. It's been really great to work with both of you, and I'm very appreciative of the connection that I've made, that YW has made with Index. I'm really glad to connect with you too. I also want to thank all of our participants today. Thank you for joining us. Thank you for your patience as we, navigated some of that technological issue. As I mentioned earlier, this has been recorded and we will share it with all of you via email. We will also be sharing it on social media. So when you see it float through, please, if you feel so inclined, share it with someone else that might, think of this as having value listening to this conversation. We will share all of the resources mentioned in today's conversation, as well as some other little things that we didn't get to. And we will also share information about legislation and all of that good stuff. So again, thank you for joining us during your lunch hour. I hope you have a great rest of your Wednesday. Bye.